Hello, I'm Daniel Jin, founder of Creation, the consultancy for insights-led health strategy. And I'm here with Mary Kangley. She's a research analyst on Creation's team.
Yeah, so I've been looking at healthcare professional conversation online over the past year in the US relating to Humira, Abbvie, its biosimilars, and the issue with pricing that's happening right now.
And Abbvie's been making deals with other companies that will potentially extend Abbvie's own kind of patent or kind of ownership of that market for a longer period of time. Talk to us about that. Healthcare professionals have been seeing news about what's happening in other countries.
Yeah, in 2018 in Europe, Humira came off patent, and that meant that other biosimilars have become available on the NHS at the NHS's choice. They've chosen to switch to biosimilars for their patients.
Right, so this happened in the UK last year.
Yeah.
And healthcare professionals in the US saw this on the news or saw this online, and they reacted to it.
Yeah, they reacted because they don't have that in the US. So in the US, they're still continuing to having to pay the higher prices for Humira, and they don't have access to biosimilars. So there's a lot of conversation happening on Twitter. Doctors who have taken to Twitter to talk about these different news articles that they're reading.
They're reading mainstream news articles.
Yes.
On like where?
So there was an article published in the New York Times that talked about Humira and the price increases that are happening, but also the international price discrepancies that are happening elsewhere because of biosimilars that are becoming available.
Okay, so towards the end of its patent, the price is going up.
It is.
Healthcare professionals are reading about this in the New York Times, and they're reacting to it online using Twitter. Yeah,
so they're taking to Twitter, they're sharing these articles. Some of them are adding their own opinions to the articles, reacting to what they're reading, and really seeming quite frustrated at what they're reading.
So what sort of opinions are they sharing?
Healthcare professionals in America are really frustrated. They're citing the article, calling it patent abuse.
They're using the term patent abuse when they're talking about Humira and Abbvie's treatment.
Yeah, patent abuse is a term that was used by the New York Times, and the healthcare professionals are continuing to share that kind of language about Abbvie and what they're doing with the drug and the patents.
So it sounds like there's quite a lot of emotion there in the response from the online healthcare professional community.
Yeah.
And the kind of words they're using and the way they're describing it.
They're saying that Abbvie is abusing its position of power. Some healthcare professionals are sharing the article from the New York Times, kind of saying, well, why wouldn't they do this? Abbvie, they're doing it because they can. They're keeping the prices up. Because why not? Because they want more money. But yeah, the healthcare professionals are annoyed and frustrated because they just want the best treatments for their patients.
So Mary, are we seeing that there are certain individual healthcare professionals who are really influencing the views of their peers in this online conversation?
Yeah, it's really normal for us to see certain individuals online who are kind of pushing the conversation, who are sharing lots of information relating to different therapy areas, but in particular here, when studying adalimumab, we saw Dr. John Cush, a rheumatologist, who was really pushing the conversation, sharing lots of articles, getting the information out there for others to see and react to.
Well, thanks for sharing that, Mary. We've been looking at Abbvie and its positioning of Humira and how healthcare professionals have been reacting to that. If you want to read the full article, Mary, you've written a deeper analysis of this. Go to creation.co, go to the knowledge section and search for Abbvie, and you'll see Mary's full analysis.
Yeah.